Well, chiropractors are doctors, and one of the key things about chiropractic is that we don't use drugs or surgery. We would fall into the realm of what's called natural medicine, meaning we use the body's own healing powers to accomplish changes. We use our hands through a series of different types of manipulations, working on the body. We use nutritional counseling, exercise, movement awareness, and a lot of those types of skills to help people's bodies heal naturally and function at its very best. Chiropractic, there's really two aspects to chiropractic. The one that the public might be more familiar with is treating of injuries, where people have injuries to their neck or their back or maybe a shoulder or a hip or a foot, and they'll see a chiropractor for an injury to get treated and get better and try and enhance their recovery process. And so we deal with anything from acute injury and accidents to more chronic types of pain and problems that people have. And it's a drug-free, natural approach to that, and it can be very effective. But the other aspect of chiropractic that a lot of people may not know is that we do what's called proactive care or wellness care. And in many ways, like athletes are like machines. So if you think about an athlete like a race car, and a race car would have a really good mechanic or a pit crew. You don't just race a car without having your tires right and the engine tuned up, and the car has to be working at its very, very best. And so what sports chiropractic does is we work with athletes from really all realms and help them function at their very, very best. So they don't come to us necessarily with symptoms or pain. I mean, they might, but they don't have to. A lot of them will see chiropractors because they want to be the very best possible athletes they can be, so we can help them run faster, jump higher, turn more quickly, be more agile, and make the very best of their bodies by, in a sense, tuning them up and balancing them. Right now, in professional sports like football, baseball, basketball, soccer, track and field, in almost all professional sports, probably 80% of the teams use chiropractic care as part of their medical staff, because we're able to bring out the best in athletes and integrate with team trainers, team orthopedists, and the strength and conditioning people. And what we do is we look at balance in athletes, we look at their range of motion, how well their muscles are firing, how their body's working efficiently, and we can have a lot of ways of going about it so that athletes can work at their very best. For example, I've worked with the San Francisco Ballet for about 20 years, and the ballet sends their dancers over to us, even if they're not hurt, but just if they feel that their bodies are out of balance, or if they, quote, feel like they need a tune-up. And when they come in, we watch how they walk and how they move, and we examine them and determine how to get their body functioning at its very best, so they can jump their highest, or if they need to bring their leg up to the back, how they can do that without straining other areas. And they found that their rate of injuries are much, much lower by doing proactive care. And so there's a number of benefits to that, and that's an important part of chiropractic that the public might be unaware of. I think one of the main distinguishing characteristics of us and orthopedists are also physicians, but they use drugs and surgery as one of their main avenues of treatment. But orthopedists are generally going to be involved in more serious traumas. Anyway, when people have more serious injuries, they often see an orthopedist. So if people are skiing and they injure their knee badly and tear their ACL, or they break an arm, or they break their collarbone, or they break their ankle, or they have a very serious sprain where there's torn ligaments and tissue and torn muscles, that's where orthopedists do their very best work, because they can evaluate and diagnose and then provide surgical treatment if necessary. If surgical treatment isn't necessary, then orthopedists basically defer treatment to physical therapists, who then carry out non-surgical care, which would be a combination of hands-on work, strengthening exercises, patient education. So physical therapists often work in conjunction with orthopedic surgeons or medical doctors, but they actually are sort of like they carry out a lot of the care for athletes in terms of exercise, strength, range of motion. There's a lot of overlap between physical therapy and chiropractic care. Physical therapists who've done extensive training have many, but not all, of the skills that chiropractors have. Chiropractors that have done a lot of training have many of the skills that physical therapists have, and the better you get, the more those distinctions can get blurred. But one of the key things that distinguishes a physical therapist from a chiropractor is that chiropractors spend hundreds, if not thousands, of hours studying joint manipulation, meaning learning how to use manipulation to move and enhance mobility in the spine and in the extremities. And it's a specialty that's unique to chiropractic that orthopedists don't do, that physical therapists don't do. A small percentage of physical therapists do what's called mobilization, where they study techniques of how to, in a sense, move joints and create a range of motion, but it's a different technique, and it's not as extensive, whereas it's the centerpiece of a chiropractic education. It's what we study the whole time that we're in school. And it's one of the things that distinguishes us from all other professions, is the amount of experience and knowledge we have with joint manipulation. But a lot of the other things in terms of soft tissue work and exercise and some of the rehabilitative things may be similar between physical therapy and chiropractic.